Getting down to more effective therapy. What is bipolar depression? It is a name given to the depression experienced in those who have bipolar disorder. Manic or hypomanic episodes are experienced within bipolar depression. Symptoms include worthlessness, suicidal thoughts, nervousness, and sleep deprivation. Drugs that are currently approved for bipolar depression treatment are quercetin, olanzapine-fluoxetine combination, and lorazepam. This treatment focuses on the acute stabilization and relapse prevention in bipolar depression. Quercetin is the earliest drug approved for the treatment of bipolar depression. It works by restoring the balance of certain neurotransmitters, serotonin and dopamine in the brain. Bipolar depression is controlled by blocking on serotonin receptors in the frontal cortex and dopamine receptors in the mesolimbic pathway, acting as antagonists. It has been postulated that one of the potential antidepressant mechanisms exhibited is the competitive inhibition of norepinephrine reuptake by norquercetin, which contributes to the constant effectiveness of the drug. The main adverse effect of quercetin is weight gain. There is a high level of insulin, triglycerides, and glycated hemoglobin noted in quercetin treatment compared to other drugs. Quercetin is associated with improvement in quality of sleep and life. Patients with a recent history of rapid cycling bipolar disorder are recommended to take this for its fast and effective outcome. However, sedation problems can occur for some patients. Another drug for bipolar depression treatment is olanzapine-fluoxetine combination. This combination treatment was approved by FDA in 2003 due to it being significantly more efficacious than olanzapine monotherapy. Exact mechanism is unknown, but the activation of three monoaminergic neural system, serotonin, norepinephrine, and dopamine enhances antidepressant effect. Combination of serotonin selective receptor inhibition by fluoxetine and antipsychotic effect by olanzapine produces synergic increases in norepinephrine and dopamine release in the prefrontal cortex, which improves concentration and mood. Major adverse effects of this combination treatment are severe allergic reaction. It should not be used for those who experience reaction to either olanzapine or fluoxetine. Olanzapine is correlated to increase in blood sugar level, thus patients with diabetes or those at risk for developing it need careful monitoring. This combination treatment have a high response and remission rate with lower discontinuation rates due to its adverse effects. On the other hand, like other selective serotonin receptor inhibitor, it increases risk of suicide in patients aged 24 years and under, as well as increased risk of death in elderly patients with dementia-related psychosis. The most recent new drug approved for bipolar depression by FDA in 2013 is lorazepam. Lorazepam acts as an antagonist for certain dopamine receptors to improve cognitive activities. Serotonin receptors improve negative symptoms and reduce extrapyramidal side effects. Lorazepam displays little or no affinity for histamine and acetylcholine receptors, thus shows less risk of sedation, weight gain, and metabolic effects, leading to adequate efficacy and tolerability. Lorazepam's major adverse effect is decrease in white blood cells and increase in blood sugar level, which can be fatal for patients. The major drawback of lorazepam is its food-drug interaction. The drug is metabolized in the liver via the enzyme cytochrome P450. Plasma concentrations may be increased when combined with cytochrome P450 inhibitors, which may lead to excessive side effects. However, lorazepam appears to have caused minimal effects on body weight and changes across metabolic parameters. It is not approved for patients under 18 due to increased depression and suicidal thoughts, and not for dementia patients as it increases death or stroke. Drug comparison. Different drugs have different downsides. Quercetin have sedation concerns, while olanzapine or fluoxetine combination have problems with weight gain and metabolism. Lorazepam's food-drug interaction requires metabolism monitoring. In contrast to other drugs, it does not cause significant changes to weight gain or metabolism. However, it is a new drug, and no clinical studies have been made so far.